I'm Jennifer Lewey. I'm a cardiologist at the University of Pennsylvania, and I'm chair of the writing committee of this AHA scientific statement on optimizing cardiovascular health for individuals who had adverse pregnancy outcomes. Adverse pregnancy outcomes are associated with an increased cardiovascular risk in women, and two recent AHA scientific statements have summarized the data on that nicely. But the question remains, what do we do with that information, and how do we help prevent cardiovascular disease for women after pregnancy? At least half of the excess cardiovascular risk associated with adverse pregnancy outcomes is due to hypertension and other traditional cardiovascular risk factors. As a result, it's important that we focus on preventive therapies to help reduce cardiovascular risk after pregnancy that we know can work for postpartum individuals. Cardiovascular disease is a leading cause of death in women in the United States, and we know that cardiovascular deaths are increasing over time. So now is the time to act to provide early education and preventive therapies to reduce the burden of cardiovascular disease in women. The postpartum period can be a challenging time for new mothers and parents. However, there are strategies we can use to reduce cardiovascular risk early after delivery. We know that breastfeeding is good for infant health, but breastfeeding or lactation also has maternal health benefits and is associated with a lower risk of hypertension and diabetes. Contraception is, of course, important to prevent unwanted pregnancies, and luckily, most contraception is safe for individuals who had adverse pregnancy outcomes, but we want to be careful to avoid estrogen-containing contraception for those who have ongoing hypertension or take medications for hypertension. Treating blood pressure early after delivery is an important part of preventing maternal morbidity and mortality. And for women who are considering a subsequent pregnancy, making sure their blood pressure and glucose is under good control in that interpartum period and during the next pregnancy is also really important. Providing counseling on lifestyle changes, healthy diet, weight modification, physical activity is also really important for individuals to hear about how they can change their lifestyle habits at home. And in Table 1 of the statement, we have specific counseling suggestions on what to say to individuals in the postpartum period about this. Hypertension after delivery is common, and we see this especially among people who had gestational hypertension or preeclampsia during their pregnancy. But even for individuals who have chronic hypertension, they may have ongoing need to treat their blood pressure after delivery. Less common is the new onset of preeclampsia in the postpartum period, but we do see that people can develop preeclampsia within 2 weeks after delivery. Treating severe hypertension is critically important to prevent maternal morbidity and mortality, and blood pressure actually peaks at day 3 to 7 after delivery, so it's very important that we follow up these patients closely. Luckily, most blood pressure medicines can be used safely after delivery, even if someone is breastfeeding or lactating. Lasix can also be used for a few days to help prevent the onset of severe hypertension. Because close follow-up is so important, home blood pressure monitoring programs are becoming increasingly accessible and are even standard of care at many institutions, which allows easy titration of medications in the weeks after delivery. Ultimately, we want these individuals to follow up with their primary care doctor or OBGYN to treat hypertension or help prevent hypertension in the years following delivery. But we know that not everyone follows up with a continuity provider, and so we must screen for and treat hypertension in postpartum individuals wherever they seek care. The postpartum period can be a challenging time to talk about lifestyle changes, but we know that it is possible to improve cardiovascular health in the postpartum period. The landmark diabetes prevention program showed us that intensive lifestyle changes can help promote weight loss and prevent the onset of type 2 diabetes in individuals who have a remote history of gestational diabetes. Recently, several trials have targeted individuals in the first year postpartum using different programs based on the diabetes prevention program and have shown success. In particular, these programs have used online modules, community-based programs, and telehealth to promote individuals to do self-monitoring of weight at home, promote healthy eating habits, and exercise more. I think these programs will offer us a lot of insight on how to improve care for these individuals moving forward. Fewer studies have focused on individuals who've had hypertensive disorders of pregnancy, but I think we'll see a lot more in this space in the coming years. In our statement, we recommend using the AHA's Life's Essential 8 framework for promoting cardiovascular health in the postpartum period. And we have a number of pragmatic recommendations that clinicians can use to focus on this. First, for blood pressure, it's important to treat severe hypertension after delivery, but to make sure that individuals have ongoing monitoring and treatment of blood pressure. It is not uncommon for individuals with hypertensive disorders of pregnancy to develop stage 1 or stage 2 hypertension in the weeks or months after delivery. Most medications are safe to use postpartum, even if an individual is breastfeeding or lactating, and calcium channel blockers such as nifedipine or amlodipine or enalapril can be safe to use in lactation. Second, glucose screening is critically important, especially in individuals who had gestational diabetes, since they have such a higher risk of going on to develop type 2 diabetes. ACOG recommends glucose screening at 4 to 12 weeks postpartum, but since it's uncommon for people to actually get this screening at that time, it's important to do diabetes screening at any point in the year after delivery. We also suggest doing early diabetes screening in anyone who's had an adverse pregnancy outcome because there is a higher risk of developing diabetes for those other pregnancy complications. Third, we recommend lipid screening in individuals in the postpartum period, preferably after 3 months postpartum. This is important because reproductive age individuals have very low rates of lipid screening, and it's important to diagnose any severe lipid disorders that might necessitate early treatment, and certainly to recommend lifestyle changes for those who have less severe disorders. Fourth, for nicotine exposure, it's important to recommend cessation from tobacco products for all of our patients, not just postpartum individuals. Fifth, we recommend pragmatic approaches to providing lifestyle counseling for postpartum individuals. Oftentimes, it's easy for postpartum individuals to start easy with walking and taking the baby for walks in the stroller or in a baby carrier, and then to work up slowly to 150 minutes a week of moderate intensity activity, which is recommended by the AHA. But it's important to remember that these patients are struggling with a lot of things at the same time, so we don't want to put the burden on them too early to do too much too soon. Weight loss can be challenging in the postpartum period, but we recommend that people try to return to their pre-pregnancy weight by 6 to 12 months postpartum. The postpartum period can be a time when many people will actually retain weight and change their weight trajectory moving forward. And certainly for individuals who have cardiovascular risk factors, it may be reasonable to consider medications or weight loss surgery if they have overweight or obesity. Referral to community programs such as the Diabetes Prevention Program can be very powerful in helping to motivate people to keep up with lifestyle changes, and more online programs are becoming available that specifically target postpartum individuals. Sixth, sleep is a fraught topic for postpartum individuals, but it's important to know that sleep apnea is more common during pregnancy and may persist even after delivery. So for anyone who had sleep apnea during pregnancy, it's important for them to follow up with a sleep specialist after delivery. In addition, sleep hygiene is important for any postpartum individual. Finally, there are some topics that are specific to the postpartum period that complement the Life's Essential 8 nicely. For one, it's important to ask about mood and to make sure that individuals with postpartum depression or anxiety have resources to treat those conditions. Finally, lactation is important to discuss since there are health benefits for mom. Great attention has been paid in recent years to the association between adverse pregnancy outcomes and future cardiovascular disease, but we actually understand very little about the mechanisms and pathways that explain this association. There are several areas in which further research is critically needed. The first is we need studies to evaluate what the mechanisms are that cause vascular dysfunction in the weeks to months after delivery. 2, we need to understand how biomarkers can be used to screen for subclinical cardiovascular disease, at what time they can be used, and in which populations. 3, we need to better understand how to incorporate a life course approach to preventing cardiovascular disease in pregnancy and potentially even preventing adverse pregnancy outcomes. 4, we need to identify multi-level strategies that will change the risk trajectory of cardiovascular disease later in life for individuals with adverse pregnancy outcomes. Finally, we need implementation studies to understand the best strategies to implement effective interventions to change the trajectory of cardiovascular risk. The main takeaway from the scientific statement is that we have the ability to improve cardiovascular health for postpartum individuals with adverse pregnancy outcomes based on current research. More research is needed in this important field, and I look forward to the studies that will be coming out in the months and years ahead.